Our lovely 36-year-old patient comes in and she's about 5 months out from her abdominoplasty and hernia repair, and she's very graciously agreed to share some of her thoughts and feelings about her entire experience.
So I found Dr. Claytor through Google reviews and reviews in a Facebook group, and somebody who said that he would repair the hernia at the same time. So I had a hernia, umbilical hernia, and large diastasis as well. Some loose skin, not really hanging, but I was more concerned about the diastasis because it made me look 3 months pregnant all the time since my last 3 babies.
And you said that your 3 babies were big babies.
The first one was large. I gained a lot of weight with each pregnancy. I gained 50 pounds each time, but then I lost it each time. But it left me with very separated abdominal muscles and, of course, the hernia.
Well, nobody can see this who's listening, but you're an incredibly petite person. So 50 pounds on you was a significant experience. And share with everyone what your journey was like to try and address your abdominal rectus diastasis.
So I did a lot of research online before kind of self-diagnosing that that's what it was. General practitioner, family physician, they don't really tell you much, but they referred me to a general surgeon for hernia repair. I met with him. He was going to use mesh. For personal reasons, I had decided I didn't want mesh. So then I sought out plastic surgeons, and I sought one that was a little closer to home, renowned locally, but refused to do any surgery on me until I get the hernia repaired. He thought I might have had 2 hernias there, but he said I needed to see a general surgeon. So that's when I started broadening my kind of Google search and found a review explaining that Dr. Claytor had taken care of another woman's hernia at the same time as the muscle plication. So that's what led me to scheduling a consult here.
Well, I love how you went through that journey, step by step by step. And so just to come in and add a little bit from the medical side of that, we all have a tiny defect or hernia in our abdominal wall because that is where the umbilical cord goes to mom. And so there must be an opening for that artery and vein to come and feed the baby. And when you're born, it tightens up a little bit, and it's mostly not evident for most people. However, when you have multiple pregnancies with large babies, your muscles get pulled apart, and that's what's called rectus diastasis. And in the process, you can have a widening or an opening of that tiny little umbilical area, and it becomes an umbilical hernia. And so, yes, I have a lot of patients who talk about, I'm told that I need mesh, and we did not use mesh to repair you. I did use permanent sutures that are monofilament, and what that means is there are no little braided areas in there, which cuts down on any chance for infection in this repaired tissue. And these sutures will stay with you forever. And here we are at 5 months, and your abdomen do you feel like it's pretty flat?
Yes, I feel like I'm kind of back to normal now and, can bend over and squat down and be on the ground level, because before that, the separation, everything kind of pushing out when I would bend down. And then, of course, the pressure behind the hernia further, I was having pain just kind of being down on my knees with the kids. And now I almost expect it, but then I'm always surprised that it feels great. I feel normal.
So are you saying you do not have any pain?
No, I do not, no.
That's fantastic. That's such a great added benefit.
Right, and I did have pain before, so the pain being gone and being able to kind of bend over in jeans and not feel all the pressure around the hernias.
Yeah, and we took pictures, and I remember your exam. You had a very significant rectus diastasis. I was able to use my fingers to push down, and I think I could even feel your aorta. Do you remember that?
You did say that, yes. I do remember you saying that.
I could feel it pulsating because there was such laxity. Excuse me. The other point that I wanted to make out, and you were wonderful in understanding it, and that was that with the umbilical hernia, where your belly button is, that tissue was basically completely replaced with scar tissue and compromised blood flow. And so I had to share with you ahead of time that I was going to need to rebuild your belly button because that one was no longer usable. Do you remember that?
I do remember that and had done, some research too on that. But Dr. Claytor was great in the consult and kind of explaining what to expect. And, I think some people, they can still kind of float the belly button, whereas mine was, I remember you said it was destroyed. So
well, and it truly, and the floating of the belly button, because where your belly button had been is like totally gone. Because I was able, I like how you said you didn't think you had that much loose skin, but if we look at your pictures now, where your belly button was I was able to pull you so tight, and that's part of the process. There's certainly times where I do float a belly button and rebuild it, but in your particular case, you had such laxity from your previous big babies that I was able to tighten that abdominal skin. But it is a very important thing to have the experience and recognize and be able to share with you ahead of time that your belly button was not salvageable because, number one, you were prepared, you were comfortable with it, and therefore I was able to exercise and had all the tools at my disposal during surgery to give you the best results that I could possibly deliver for you.
Mm-hmm. Yeah, and I will say, because anybody listening can't see my picture, but the belly button had basically, like when it pops for some people during pregnancy, it had stayed in that form afterwards because of the hernia behind it. And so just wearing any kind of, being like otherwise smaller, petite size, wearing any kind of shirt, it would push out there.
A true outie?
Yeah, so it was really hard to kind of cover up. Always wearing very loose clothes, wearing a second shirt underneath for the compression to try to hide it, and now everything's just completely flat. I can go back to wearing normal clothes and fitted clothes, and yeah.
Have you gone bikini?
I have. I've already bought one, yes, for the summer.
Would you ever wear a bikini before?
I always did before babies. Afterwards, I had to wear the super high-waisted, like as high as you can go to completely cover it up.
Yeah.
So now I can wear a normal swimsuit.
That's fantastic. Mm-hmm. Well, you're very kind and generous with your experience to share this with everyone, because many times patients will come in and they'll say, geez, if I could only hear somebody's experience, and so they'll be able to tune into this and listen. But I always like to ask, is this something that you would recommend to a friend of yours?
Absolutely, yeah. And I would do it again. For sure. I was really worried about the recovery. Honestly, it's great to have a good support system. My husband was great with the 3 kids. Dr. Claytor and the staff here were great. I know I was able to reach Dr. Claytor by phone. I think I even called at like 10 o'clock at night one night. So, and then Julie here in the office spoke with me numerous times as well during recovery.
Well, you're wonderful in sharing your experience, and thank you very much.
Thank you.